Hello, my name is Jerold, and I want to thank the organizers for allowing me to record my presentation since I'm unable to be there due to health reasons. Um, Using genetic screening and molecular genetic testing in dog breeding. So a little bit about me. I am an adjunct professor of clinical genetics at the Cummings School of Veterinary Medicine at Tufts University. I've studied dog breeds as a population geneticist for over 40 years. I am the chairman of the Hereditary Disease Committee of the World Small Animal Veterinary Association. And I am on the board of directors of the OFA, the Canine Health Information Center, a not-for-profit organization and the largest repository of health screening information on dogs in the world. But primarily, I am a small animal solo practitioner, and for the past 40 years, I have treated dogs and cats, primarily pet dogs and cats, throughout their lifetime, and have followed and understood as a geneticist and a veterinarian the hereditary diseases that we see in them. In addition, my wife Candace and I are breeders of Gordon Setters. This is Bobby, our dog, on the day he achieved his junior hunter title, and we celebrated by spending 2 hours getting all the sticks and twigs out of him. This is his littermate Maddie, who won a dog show in New York City who took breed at a dog show in New York City a few years ago. These are homebred dogs, and Maddie took breed 3 years to the day after her mother took breed, who was also a homebred dog. And this is just Mr. Smith. He was our first master hunter, and he wanted to say hi as well. So I'm coming to you as a geneticist, as a practitioner, and as a breeder and dog owner. So breeding pedigree dogs is all about selection, selection, selection. So when we talk about selection, we need to understand if this represents the gene pool of a breed, and then we want to select dogs for breeding that have certain characteristics. Let's say we want a nice level top line, and we don't want dogs that have coarse shoulders and a poor top line or tail set, that we are selecting dogs in this selection plane here, and we are eliminating from consideration the dogs outside of that selection parameter. And let's say there's a genetic test that's available for hereditary disease in our breed. And so we apply that genetic test and we want to breed just normal dogs. And now we see that we're only looking at dogs within this area of the gene pool that fulfill both of our selection criteria. And let's say that there are other conformational as well as hereditary screening tests that we want to do. And very quickly, due to all the planes of selection that we're looking for, there's only a small population of dogs that we're really considering for breeding in the next generation. So what does this tell us? It tells us that it's very important that if we are using selection, that we are applying it properly, that if we are using a hereditary disease test, that it is an appropriate test and it is a validated test for our breed. Otherwise, we're using improper selection. We're eliminating dogs that shouldn't be eliminated. We are restricting our genetic diversity, and poor selection or improper selection is worse than no selection at all. So we need to understand about selection and about health. We need to understand about the differences between breeds and species. Species develop through natural selection. Any change that improves the chance of survival and the ability to reproduce will increase in frequency. So that is the biological imperative of species: survive and reproduce. That's all a species needs to do to continue. Lines that are disadvantaged will diminish in influence and will die out. An entire species die out in that way. Breeds develop through artificial selection. We select for body type, color, coat type, behavior, and conformational aspects. If health is not selected for, then there can be no expectation of genetic health in breeds. So if we are selecting, we need to purposefully select for health. Otherwise, we are not selecting for health and we are selecting for disease. Studies of dog breeds estimate that they lose on average 35% of their genetic diversity through breed formation. As only a small number of dogs are used to produce the next generation, it is like a genetic bottleneck in each generation, and rapid change can occur in the breed's genetic background. And this is why it's important that we utilize the breadth of our breed gene pools in producing the next generation and not reduce our genetic diversity. The popular sire syndrome is the #1 reason for reduced genetic diversity in breeds, where an entire breed will truncate on a single sire line. And this can become multi-generational over sons and grandsons as well. And it causes the elimination of other quality male lines that should be contributing to the gene pool and maintaining the breadth of the gene pool diversity. Selection over generations will create homozygosity, the uniform, purposeful selection for breeding goals, and diminished frequency of undesirable genes due to selection for health and for quality. Even without close line breeding, selection for positive traits will increase their homozygosity, having originated from distant ancestors. So selection equals homozygosity. If you are selecting for something, you are selecting for the genes that cause them, and you are selecting to pair up the homozygous genes and gene pairs to do so. So this is purposeful, and this is what selection does for us. Molecular genetic homozygosity testing by commercial companies, the Mars Genoscoper data shows us that mixed breed dogs have 36% homozygosity, whereas pedigree dogs, on average, their dog breeds have 45% homozygosity. So that means that the difference between mixed breed dogs and the average pedigree dog breed is about 9% of homozygosity. So we're not talking about mixed breed dogs being all heterozygous and pedigree dogs being all homozygous. It really is just a small percentage. Genetic disease is not a function of homozygosity or inbreeding, but of the accumulation and propagation of specific disease liability genes. Homozygosity is not inherently correlated to impaired genetic health, nor does it need to be artificially controlled. Some breeds were established based on line breeding to certain specific mutations, and those breeds tend to have higher homozygosity. Other breeds were based on working phenotypes, where any dog that can fulfill a working phenotype was utilized and brought into the gene pool before the stud book was closed, and those tend to have lower average homozygosity. But genetic disease has to do with liability genes and not the percentage of homozygosity. Any selection will cause a loss of genetic diversity. This loss is not detrimental to the population if it is directly related to increasing its superiority. These are necessary and expected consequences of breed formation and evolution. When you go to a dog show, you look in the rings and you know exactly what breeds are in there due to homozygosity. And this is what we select for. This is not a bad thing that we did. This is not an improper thing that we did. We have created breeds and we want to create healthy breeds. So let's talk next about diseases and disorders, or what I call, watch for it, the dark side of breed development. So this is one of my favorite cartoons called Get Fuzzy. And Rob says, ever heard the expression familiarity breeds contempt? And Satchel sits there and ponders, and he says, no, in the dog world, we say familiarity breeds hip dysplasia. This is what the general public believes about pure pedigree dogs, that they are inbred and therefore they have inherent genetic disease. However, peer-reviewed published studies show us that the most common genetic diseases of dogs occur in equal frequencies across both purebred and mixed breed dogs. And it's only the breed-specific diseases that we see in purebred dogs, many of them at low frequency, occasionally at high frequency. So the common canine genetic disorders, the number one genetic disease that we see in dogs is allergies. And we see that as veterinarians every day. And allergies are highly heritable. They are as heritable as many of the traits that we select for in production animals. Studies on labs and golden retrievers show that allergies are about 25 to 30% heritable, meaning that 1/3 of the expression of allergies is due to inherited genes. Hip and elbow dysplasia, inherited cancers, patella luxation, non-struvite bladder stones. Struvite stones are caused by infection. All other bladder stones are caused by inborn errors of metabolism and are inherited diseases. Hypothyroidism, which is autoimmune thyroiditis, the production of autoantibodies against the body's own thyroid gland. Mitral valvular disease, especially in the small bodied breeds and the toy breeds. Inflammatory bowel disease, diabetes mellitus, retained testicles, umbilical hernias. These are all common inherited disorders. So how do breed-related deleterious genes accumulate? Number one that we're talking about during this conference this weekend is direct selection for disease-associated phenotypes, extreme selection. So we need to back off on extreme selection when we see disease occurring due to selection. This is the more is better syndrome. Bigger dogs, smaller dogs, more extreme pushed-in faces, more extreme angulation, more extreme hair, more extreme skin folds, more extreme skin. So it's great that we have all the variation in the breeds that we have, and it's wonderful that we can select for them and create the breeds that we have created. But if we start to see disease creeping in due to selection, we need to moderate that selection. And that moderation is through both judging education as well as breeder education and selection, so we have a more moderate phenotype that does not predispose to disease. We can see disease-related genes accumulate due to linkage to selected traits. So there are some genes that lie close on a chromosome to a selected trait for a breed. The hallmark disease for this, as an example, is the Dalmatian spotting and the gene for urate bladder stones. Deleterious genes can be carried by popular sires. And so again, a popular sire effect that can cause rapid accumulation of deleterious genes. Primarily, deleterious genes accumulate through genetic drift, which is just the random movement of genes in the background of the gene pool, and that just by random selection that they can increase in frequency and start to become breed-related disease. But the biggest reason that we deal with right now with the accumulation of disease-related genes is the absence of selection against deleterious phenotypes, the absence of selection against disease, and ignoring disease as saying, well, this is something that happens and what we see in our breeds. We need to select against disease and create healthy dogs. Breeds with small populations look the same as breeds with large populations did much earlier in their evolution and development. So, some molecular geneticists and some people are concerned that breeds have very limited and small gene pools, and that they don't have enough genetic variability to sustain themselves. However, even Labrador retrievers started as a very small population breed, and look at the size of them now and the diversity of them now. So really what we need to do is breed these breeds and expand their gene pools and select for quality and for health. Selection of breeding animals should represent the quality traits and breadth of pedigree background. Quality lines should not be abandoned. So if there are breeding lines where a breeder is becoming older and decides to stop breeding, and they have quality lines, we must ensure that those lines are included in the breed's gene pool and maintained going forward. We don't want to lose quality lines from the breed gene pools. Healthy breed gene pools require expanding or large stable populations. And expanding gene pools allows the creation of new family lines. It allows for increased within breed diversity. And population contraction can cause the loss of breed diversity and quality breed lines. So genetic diversity, breed genetic diversity has to do with differences between dogs in the breadth of the breed gene pool, differences in their backgrounds. Unfortunately, commercial genetic testing companies equate genetic diversity with homozygosity measurements. Let's think about that for a minute. Let's say that there are 4 dogs that represent the breadth of the gene pool of a breed that are representative of the lines in the breed. And let's say that 2 of those dogs are related to each other in a familial line, and 2 of those dogs, the opposite dogs, are related in a familial line. If we breed those pairs of dogs together, we're going to have high average homozygosity in the breed due to line breeding. If we cross those 2 lines together and breed the 2 pairs that are unlike each other, we're going to have very low homozygosity and high heterozygosity in the breed, and that would be considered an outbred breed. Have we changed the genes of that breed? Have we changed the frequency of the genes of that breed? Have we changed the deleterious genes in that breed? No, it's only due to differences in breeding practices that we have changed heterozygosity and homozygosity. And it has nothing to do with the diversity or the genes that are present in the background of that breed. Molecular geneticists are not population geneticists, and they were taught by population geneticists that are endangered species geneticists, because that is what population genetics is in the animal world. And these endangered species geneticists design species rescue plans or species survival plans, and they are based on homozygosity measurements to keep deleterious recessive genes from expressing. You always breed the least related to each other to try to keep recessive genes that are deleterious from pairing up in the offspring. And this calls for constant outbreeding and the absence of selection to randomize the genes in the population. Well, this is completely different than what we do with dog breeding. We use selection. We use different types of matings to bring in traits, to eliminate traits, and so it's a completely different paradigm and completely different system than that for species. And certainly the vast majority of breeds do not need breed rescue or species survival or breed survival plans in order to survive. They just need selection for quality and for health. So breed gene pool diversity requires distinct lines in order to create selective pressure. We need dogs that are different from each other. So if I have something that if there's something that I don't have, I can look and see what dogs have those things and bring them into my line. So we need diversity and distinction between lines. Outbreeding plans are self-limiting because as you remove the genetic differences between individuals, it becomes increasingly harder to outbreed or find mates that are genetically unlike each other. So if they're telling us that the best mating is to breed 2 individuals that are the least, that have the least common ancestors and would create the lowest homozygosity in that breeding or inbreeding coefficient, then the resultant offspring, those 2 lines are now related. So now you have to find a 3rd line that's unrelated to those 2 lines to breed to, and after that generation, all 3 of those lines are related. And now you need to find a fourth line that's unrelated to those first three lines and breed to it. And now all of those lines related. And very quickly, you're going to run out of unrelated lines, and you've homogenized the breed and through outbreeding, and you have eliminated the differences between lines, which is what we need for selective pressure to actually utilize selection. Outbreeding will not change the frequency of deleterious genes. For dispersed breed-related deleterious genes, outbreeding will not decrease the frequency of affected individuals. And for breed-related disease, those deleterious genes are already distributed in the background of the breed. So when we study hereditary disease, we don't find that there's a significantly higher incidence of affected dogs with higher inbreeding coefficients than lower inbreeding coefficients for breed-wide breed-related disease. And if you want to know what that would look like, affected individuals being produced in a random fashion, all we need to look at is our cat population, because 95% of our cats are random bred or domestic short hair or domestic cats. But we see all of the inherited diseases of cats in our random bred cat populations in the veterinary clinics every day. Inflammatory bladder disease, hyperthyroidism, inflammatory bowel disease, diabetes mellitus, all of the hereditary diseases of cats we see in random bred cats, but we see them randomly. Recommendations for selection to increase the heterozygosity or minor allele frequencies do not select against disease liability genes. So what the molecular geneticists are saying is, if you need to outbreed, if you have a high frequency of a certain marker, and these are just what are called SNP markers, or single nucleotide changes. So if there's an A instead of a T, that is a marker that is a difference between individuals. And if the A marker is at a much higher frequency than the T marker, they want you to raise the frequency of that T marker to equalize it and increase the heterozygosity of those markers, and in general, increasing the heterozygosity of the breed. However, selection causes homozygosity, and by blindly selecting for markers that they have no idea what code for them, this may reverse the effects of positive selection through blind manipulation of minor frequency genes. It is likely that minor frequency alleles and genes are minor because we have selected against them for generations, and they are telling us that we need to select for those minor frequency genes when we have no idea what they code for. So selection for heterozygosity blindly selects against the good homozygosity that has been accomplished through generations of selection. Selection equals homozygosity, and this is how we have created all of our different breeds. They cannot differentiate the good homozygosity from deleterious homozygosity without validated identification of disease liability genes. If molecular geneticists can tell us that a gene is validated to cause disease in our breed, then absolutely we select against it. But just telling us we need to select for minor frequency alleles to increase heterozygosity is improper selection. Commercial genetic testing companies have discovered the tools to identify homozygosity within breeds. But in identifying these tools, they are instructing breeders to use them as the goals of breeding, to only outbreed to unrelated dogs and increase their genetic diversity. So we know what line breeding does. Line breeding fixes and increases the repeatability of certain traits in our dogs. We know what outbreeding does. Outbreeding brings in novel genes that we don't have, that we want, and that we want to bring into our lines. And these are the tools that we use in selection, but they are using them as goals instead of as tools. It's like having a hammer and all of a sudden everything looks like a nail. Breed health should not be judged on statistics of inbreeding coefficients or homozygosity, but on breed health surveys that accurately document the frequency of genetic disease. What is going on in our breeds has nothing to do with a number. It has to do with disease and what diseases we are seeing. A healthy and diverse breed gene pool should have outbred clusters as well as different line-bred families. We need lots of different lines and lots of different combinations in order for selection and breed quality to work. So my mantra is that genetic diversity is breeder diversity. It is the varied opinion of breeders as to what constitutes the ideal dog and their selection of breeding stock that maintains breed diversity. If some people want to line breed on a certain line and other people want to line breed on a different line, if some people want to outbreed, if different people are doing different things with their matings depending on their needs for the next generation, that is what creates genetic diversity and maintains it in our breeds. Everyone line breeding would be a bad thing. Everyone outbreeding would also be a bad thing. Everyone doing exactly the same thing and all running to one corner of the gene pool would be bad for our breeds. So it is the diversity of selection of breeders that maintains our genetic diversity. Improving breed population health through health-focused breeding. Early on, breeders judiciously removed animals from breeding that were unhealthy, could not excel, or did not conform to a healthy standard. Somewhere along the way, the responsibility to select for health and produce healthy offspring disappeared from breeding. People just breed and expect healthy offspring. If artificial selection does not select for health, or selects for deleterious traits, then there can be no expectation of genetic health, and the genetic health of the breed will decline. Health screening is a requirement, not a choice. The proper use of health screening actually increases breeding choices. If a breeder was planning on breeding an animal prior to receiving a carrier test result, the proper response is to breed to a normal individual and eventually replace the carrier parent with a quality, normal offspring. For recessive diseases with a direct genetic test, a direct genetic test result should not alter who gets bred, only who they get bred to. And this is a quote from Dr. Paula Henthorne at the University of Pennsylvania in the USA. And it's an excellent quote as to how to properly utilize genetic testing. The only way to select against specific genetic disorders is to specifically select against the causative or liability genes through either direct genetic testing or phenotypic genetic screening. So pre-breeding health screening evaluates the health worthiness of the dog for breeding. And this is where we really need to make a change here, where if a dog is being evaluated to be used for breeding, that we need a veterinarian to do a pre-breeding health screen on the dog. And if the public demands healthier dogs, then this is where it must occur. This is the absolute way that we are selecting healthy dogs for breeding. The most common genetic diseases of dogs are complexly inherited, involving several genes and environmental factors. Most have no genetic or DNA test. Many have no screening or diagnostic test and require medical history for diagnosis. Allergies, seizures, inflammatory bowel disease. Breeding control requires knowledge of familial history of affected individuals. So for health screening, there are two types of screening. Tests of the phenotype or genetic screening, which are primarily to identify clinically affected individuals. Hip radiographs, heart auscultation, patelloluxation, thyroid profiles. And then there are tests of the genotype or genetic testing, which are direct DNA tests for liability genes and for linked markers. Most genetic screening only has to be performed once in the animal's lifetime. Direct genetic tests can be run at any time, even as puppies, before sales. So if you've bred a carrier to a normal for a disease that occurs in your breed with a valid genetic test, then you can identify carriers that can go into pet homes and be absolutely normal their entire lives if it's a recessive disease, or normal individuals that you may want to select for quality and place into breeding homes. Hip and elbow radiographs at the proper ages, coagulation disorder testing, heart testing for congenital disease such as subaortic stenosis. Some tests need to be repeated depending on the age of onset and age requirement for diagnosis. Eye examinations, especially for later onset diseases such as cataracts or PRA, thyroid testing, where that window of 2 to 6 years of age where those autoantibodies start to show up becomes an important factor in when you do a thyroid profile. Heart auscultation for valvular disease that progresses during a dog's lifetime. Spinal radiographs for disc calcification as indicators of liability for intervertebral disc disease. And there are excellent programs that have been developed in Europe for this in dachshunds and in other breeds. Pre-breeding health screening. A pre-breeding health examination by a veterinarian includes the major organ systems for musculoskeletal, cardiac, eye, GI, respiratory, skin, and behavioral abnormalities. It should also include breed-specific genetic screening for the breed-related diseases. And these are often listed by different kennel clubs or by different organizations such as the OFA as what are the specific breed-related genetic testing that should be done. Pre-breeding health screening should become as universal as equine pre-purchase examinations, my second mantra. If you're a horse owner, you don't purchase a horse without having a veterinarian do a pre-purchase examination, because you don't want to buy a horse that you may never be able to utilize for the purpose that you're buying it for. If they have navicular disease, if they have laminitis, if they have different diseases that'll prevent you from ever riding that horse. So a pre-breeding health screening should become as universal as a pre-purchase examination. And we need to change the public's mindset as to what questions they ask when they go to a breeder or when they look to purchase an animal. They need to ask for the results of pre-breeding health screening. So what are some of the issues with genetic testing? The issues are that all commercial genetic tests are not equal, and some have not been validated in any breed. So with the genetic panels that have now been run, what we're finding is that disease liability genes that cause a disease in one breed are now being identified in many breeds. And so the genetic testing companies want to report those as carrier or even affected test results when those genetic diseases have never been actually identified in those breeds. So for every genetic disease that can be tested for, it needs to be validated in each breed before the genetic testing companies report them to you as affected or carrier within your own dogs. So just as an example, because the biggest example is the SOD1 mutation for degenerative myelopathy. Now, degenerative myelopathy is an infrequently diagnosed disease, primarily seen in two breeds, German Shepherds and Boxers. There are a handful of other breeds that have familial disease, that have accumulated other genes that have allowed that degenerative myelopathy gene, when homozygous, to express itself. Pembroke Welsh Corgis, Rhodesian Ridgebacks, Chesapeake Bay Retrievers, Cardigan Welsh Corgis, Bernese Mountain Dogs, Borzoi. But we see these very infrequently in those breeds and not at the frequency of the two primary breeds. However, the SOD1 mutation is the most frequent mutation found across all breeds. It occurs 7.8% frequency in mixed breed dogs, and on average between all breeds, 5.4% frequency in pedigreed dogs. And in some of those breeds, the frequency of this gene is over 90%, but no one in that breed has ever been diagnosed with degenerative myelopathy. And so we need to understand that validation of these gene tests in each breed is important. Cone rod dystrophy is the second most frequency, or CORD1-PRA, a gene across all mixed and purebred dogs. But this disease is only seen in miniature long-haired dachshunds and English Springer Spaniels, and it has never been definitively diagnosed in other breeds. So we need to understand about validation. And the International Partnership for Dogs, through their Harmonization of Genetic Testing for Dogs website, they are working with the researchers on validation to report what genetic tests are actually validated to cause disease when homozygous in each individual breed and which ones have not. So they are doing a good job in trying to set this validation issue straight, as well as the World Small Animal Veterinary Association and other associations that are working on gene validation. So I also want to touch on two other things: estimated breeding values and genomic breeding values. So estimated breeding values are breeding values based on the phenotype of the individual plus that of the close relatives. And this is based on production animal science. However, it requires fairly complete phenotypic evaluations of all close relatives, including all normal and abnormal siblings within litters. So in production science, it's easy to collect that data. But in dog breeding, we're not getting hip radiographs on pet dogs and on complete litters. And so there's a lot of missing data, and therefore the strength or value of estimated breeding values may be quite low without all of that information. And EBVs are breed specific, because diseases are inherited differently between breeds. And EBVs are being used for hip dysplasia in several countries around the world. And I wanted to touch on genomic breeding values, which are breeding values based on a set of DNA markers linked to disease. And this is where a researcher will take a group of affected dogs and a group of unaffected dogs and try to figure out through genetic markers what markers move with the affected dogs and are not present in the unaffected dogs to separate them. But DNA markers are not specific for liability genes, and they're only specific for the population being studied. And they require extensive validation in multiple populations before they can be applied to a larger breed population. There was a DNA panel many years ago for hip dysplasia, which was proven to be not validated and with improper selection applied by many people that utilize them. And today, at this point, there are no genomic breeding values that have been validated in dogs for disease. So this is still something for the future. So lastly, I'd like to talk about the genetic control, the breeding control of complexly inherited disorders, because that is what the majority of genetic diseases are that we deal with in dogs: congenital heart anomalies, hip dysplasia, patelloluxation, allergy. So we need to identify phenotypic traits that are more closely tied to possible underlying genes. Phenotypic breadth of pedigree provides information on the possible range of genes carried. We need to treat disorders as threshold traits, where multiple genes must combine to cross a threshold to cause disease. And we need to breed normal dogs from mostly normal litters. So using hip dysplasia for an example, we need to have deep acetabula or hip sockets. We need to have round femoral heads, and those femoral heads need to be deep in the sockets. So if we have a dog that has less than perfect hip conformation and it has slightly shallow hip sockets, we would like to breed to a dog that has deep sockets and try to isolate the genetics for that trait. If the issue is laxity, then we need to breed to a dog that has tighter hips than our dog in order to improve its conformation. Depth of pedigree is what many breeders select for multiple generations of normalcy, but breadth of pedigree normalcy actually provides more information on the genes that can be carried by the individual dog. So if we have a normal dog that comes from a mostly normal litter, we can be pretty happy that this dog probably has a low level of liability genes. But if we have a dog that comes from a litter that has a lot of hip dysplasia or disease, then we need to question the amount of genetic liability that this dog carries and what it can pass on to future generations. If we say theoretically it takes 5 genes to cause a disease, and if the average between the two parents is pretty close to that threshold, we can't be surprised to see that disease in that litter. But we do need to understand that if 2 phenotypically normal dogs are bred together and produce an affected individual, that both parents had to contribute liability genes to produce that affected individual. It wasn't just that damn stud dog that you bred to. So let's talk about genetic databases, because in order to understand breadth of pedigree, we need to understand what siblings and close relatives have in terms of disease expression. In the US, we have what was the Orthopedic Foundation for Animals and is now the OFA, the Canine Health Information Center. And I don't have time to go to it, but look at the website. It's broken down to information for prospective owners, for breeders, and for veterinarians. You can look up individual dogs with their own web pages that show their test results, the results of their close relatives, vertical pedigrees. You can look up statistics for each individual breed on what percentages of the different diseases that they have. And there are breed health surveys within the website as well. Health-tested parents for healthier puppies is a motto of the OFA, and the OFA test results appear on AKC registrations, certificates, and as well as the dogs that pass CHIC requirements. And CHIC are the required breeding tests before a dog is used for breeding as determined by the parent club. And these are also identified by many kennel clubs around the world for each breed. I wanted to show you this. This is the results of close to 500,000 dogs that have OFA hip radiographs, where both parents also had OFA hip radiographs. And the ratings for the OFA are excellent through severe. And we've numbered them 1 through 7 for the dam and 1 through 7 for the sire. And when you add up what's called a combined health score, we have the results in here. So a combined parent score of 4 can be a fair to an excellent, a good to a good, or a fair to an excellent. And these numbers are all correlated to each other. And I want to show you that good to good encompasses over 200,000 dogs, but a moderately dysplastic to a severely dysplastic dog encompasses 52 dogs here and 9 dogs there. But to show you the combined parent score for hip dysplasia, looking at that OFA data, hip dysplasia is being inherited linearly as a totally additive trait based on the hip radiograph score. So there is a genetic difference between an OFA good, an OFA fair, and OFA excellent. And the only outlier here are those less than 100 dogs of the moderate to severely dysplastic dogs. If we add then normalcy of the grandparents, if there are 0 normal grandparents, 1, 2, 3, or 4 for individual dogs, we then continue to have a decrease in the frequency of hip dysplasia, even in a combined parent score of 2, which is excellent, bred to an excellent. So showing the depth and breadth of pedigree normalcy is what you need to look for when controlling complexly inherited disease. So in closing, all populations thrive by avoiding the popular sire syndrome, utilizing quality individuals from the breadth of the population to expand the gene pool, monitoring genetic health issues in breeds through regular health surveys, doing genetic testing and screening for breed-related disorders, participating in open health registries to manage genetic disorders, and constant selection for health and quality. And I leave you with a quote from William Feeney, who is a past chairman of the AKC Board of Directors and Director Emeritus of the OFA. All dogs deserve to live healthy lives. Thank you.
I want to thank the FCI board members for giving Mexico the opportunity of having this important World Congress for Welfare and Health for the dogs worldwide. We are really pleased, and thank you so much for giving us this great opportunity. And also I want to thank all the speakers from all over the world who participate in this great event. Thank you.